Hi everyone, welcome to Fertile Minds. My name's Vanessa Lusink and I'm a fertility specialist with Queensland Fertility Group in Townsville. Today we're going to talk about fibroids and endometriosis, two topics that are close to my heart and unfortunately affect a lot of women throughout their reproductive lives, and it can certainly impact fertility in lots of different ways. Fibroids are balls of non-cancerous muscle that form within the uterus. They can cause infertility in a couple of different ways by either distorting the anatomy of the uterus or impairing the inside cavity of a uterus where a baby needs to implant. Fibroids can also cause blockages in things such as the fallopian tubes, which then stop the egg from being fertilised by the sperm, which then result in infertility as well. Endometriosis is a really common condition. It affects probably about 10% of women. And unfortunately, we know that a lot of endometriosis presents in very different ways. So some women can have very bad pain. Some women can have no pain, but have terrible endometriosis that really impacts their fertility. Endometriosis can impair fertility in a couple of different ways as well. And that can be via either creating really abnormal anatomy, blocking things like fallopian tubes, impairing the ovaries and its ability to release an egg or the quality of an egg, and can also just create such an inflammatory environment within the pelvis that it results in infertility. Fibroids and endometriosis not only affect fertility itself, but they can also affect things such as pregnancy. Fibroids in particular can become very large during a pregnancy, and they continue to grow with the increased blood supply to the uterus during pregnancy. If that occurs, it can cause a number of issues, including concerns regarding the growth of a baby, or difficulties with delivery of your baby, or increased risk of bleeding afterwards. And fibroids are certainly something that need to be monitored closely during pregnancy. Fortunately, endometriosis doesn't cause too many issues, and in fact, normally pain improves from endometriosis when you're pregnant. However, it can certainly cause difficulties in falling pregnant. Diagnosis of things such as fibroids is normally fairly simple, and they're seen on a pelvic ultrasound, which you would have as part of your workup for fertility treatment. Treatment then depends really on the size of the fibroid, the number of fibroids and their location. Treatment can be as simple as needing a relatively minor surgery where the fibroid is removed from the inside of the uterus, through to needing a more complicated surgery where we actually remove the fibroid from the muscular layers or the outer layers of the uterus. That can be done either by a keyhole surgery or an open surgery across your tummy, depending on the surgeon that you see. Endometriosis, your options for treatment really depend on what the main concern is. If that's fertility, then often we'll consider whether IVF is in fact the best treatment for you. Whereas if pain is more of a concern for you, surgery or medical therapy as well may well be indicated. If you think that you're troubled by either things such as fibroids or endometriosis, we'd encourage you to see a fertility specialist after you've been trying for a pregnancy for 6 months, or even before you start trying for a pregnancy, to get a plan in place for if there are any concerns regarding conception. It's important to note that while endometriosis and fibroids can make it harder to conceive, many women go on to conceive successfully and have a successful pregnancy. Thank you for watching. We'd encourage you to like, subscribe, and then leave any questions in the comments.